Please welcome Dr. Sanjeev Sarimam, who is a pediatrician in Southeast Washington, D.C., and an assistant professor of pediatrics at the George Washington University School of Medicine. Dr. Sarimam.
Good afternoon. My name is Dr. Sanjeev Sriram, and I'm a pediatrician in Southeast Washington, D.C. For 7 years, I have cared for a patient I'm going to call Sean. I met Sean when he was 13, newly diagnosed with type 1 diabetes and still adjusting to checking his blood sugar and regularly doing those insulin injections. I earned his trust because I never judged him when he had setbacks, and I always kept it real. Sugarcoating is not recommended for diabetics. Together, we have made his diabetes and his mental health issues manageable conditions that he controls rather than his conditions controlling him. He is now 20 years old, a graduate of a rigorous vocational skills program, and eager to get a job. 2 months ago, Sean told me he wanted to look for work in Virginia, but then he would not have Medicaid like he does now. Sean's mother has become a friend of mine, and I've recently learned her health is struggling. She will not be eligible for Medicare for at least 10 years, and none of her 3 jobs come with health insurance. Fortunately, she lives in D.C. and qualifies for Medicaid, but if she lived in her home state of Texas, she would be uninsured. Sean and his family are like hundreds of patients I see in Southeast D.C., and they are like millions of patients community physicians are seeing every day across America. I greatly appreciate how the Affordable Care Act has made life easier for Sean and his family, but their experiences highlight ongoing problems with our healthcare system. Uninsured African Americans are twice as likely as white people to have no coverage if they live in states that have not expanded Medicaid. Too many women and low-income families are stuck in Sean's mother's situation, working multiple jobs with no health benefits, or they're wondering if their health insurance premiums are worth the financial sacrifice. As a physician, I know what Medicare for All would mean for patients like Sean and their families. It would mean we are finally making healthcare a basic human right, no matter what you earn, no matter where you live, and no matter what you look like. Doctors like me, and patients like Sean, and mothers like his mom, have not worked our butts off to stay healthy and alive just for insurance companies to price people out or for politicians to play games with the basic human right of healthcare. When it comes to health policy, a lot of people quote Senator Ted Kennedy, but I want to echo his older brother. On this day, 55 years ago, President John F. Kennedy challenged Americans to reach for the stars. Today, I am asking my fellow Americans to reach for their hearts. We choose to build Medicare for all. We choose to build Medicare for all now and do the other things, like cheaper prescriptions and reined-in healthcare costs, not because they are easy, but because they are hard. Because Medicare for All will serve to organize and measure the best of our energies and skills to improve American healthcare. Because that challenge is one that we are willing to accept, one we are unwilling to postpone, and one we intend to win. Thank you.
Good job. Well done. Thank you.
Thank you, Doctor. Melissa Johnson Camacho is an oncology nurse at a major teaching hospital in Northern California. She is a member of the California Nurses Association, National Nurses United. Melissa?
So like Bernie was saying, Senator Sanders, my name is Melissa Johnson Camacho. I've been an oncology nurse for almost 10 years. I've been working hard with National Nurses United and the California Nurses Association all across this nation. We're trying to make a more humane healthcare system. We want one that's based on patient needs and not pain and profit. I'm here today because of my patients. I'm here to advocate for them. And for cancer patients, Medicare for All would be crucial. It would be an enormous relief. And for some, it's going to mean the difference between life and death. Most people don't realize that a cancer diagnosis is not just a very frightening diagnosis, but what comes with it is also financial devastation for far too many. And because of high deductibles and out-of-pocket expenses, we have tragic cases of people who don't even get to the treatment that they need. There are patients that I think about every day. One young woman still lives deep in my heart. Her cancer had metastasized, and her lungs filled with fluid consistently. She needed to have the fluid drained in order to breathe, to survive. I noticed she never completely emptied the bags, which meant her lungs never were all the way clear. When I asked why, it was because she could not afford to change the bag more than just once per day. These bags are very expensive, and her insurance did not cover the full cost. She was never able to take a deep breath, and she lived in constant distress and pain, struggling to breathe. And to make matters worse, the insurance policy soon renewed. That meant her annual deductible was in place, and she would have to pay the full amount of her medications and supplies until that deductible was met. That young woman spent the rest of her life in unnecessary stress, unnecessary pain, and unnecessary agony. She never again was able to take a full breath for the rest of her life. And as far as I'm concerned as a nurse, this is treatment denied. This is treatment she needed and deserved. Thank you. Thank you. To me, it is immoral that anyone profits off another person's need for health care, and it is repugnant to me that this profit comes from denying care. I see the suffering and pain this causes every single day in the faces of my patients. This system is killing too many of my patients, and I say no more. Let's put an end to this immoral system that's putting profits before patients' needs. Registered nurses like me know the only way that we are going to do this is with Medicare for All. I want to thank all the senators that are co-sponsoring this bill. And healthcare is a human right, and we are going to make it happen. Thank you.
Rebecca Wood is a mother and patient who is sharing her story with us of choosing between her daughter Charlie's treatment and her own. Rebecca? Do you need help with the baby?
I'm going to send her to bed.
Some of us.
Okay. Hi, I'm Rebecca Wood. I'm from Charlottesville, Virginia, and this is Charlie. Hi, Charlie. She's kind of bouncing around the room, as you guys may have seen, so I'm going to send her to Ben. You want to go sit with Ben? He's got your goldfish. Okay. My family story begins like many. My husband and I met, graduated from college, got married, found employment, and decided to start a family. Our story diverges from the norm at my child's birth. Due to preeclampsia, my daughter Charlie was delivered via emergency C-section 10 hours into her 26th week of gestation. She weighed 1 pound, 12 ounces, and was the size of my hand. My constant NICU bedside vigil started because I did not want her to die alone. Charlie was tough and a fighter. After 3 months, she was well enough to come home. We thought it was over, but it was merely the end of the beginning for us. Issues from her premature arrival appeared one after another. Each one required treatments and therapies. There was specialty formula, medications, and formula thickeners. After that, she needed physical therapy, speech therapy, occupational therapy, and orthotics. The list grew and continues to grow to this day. Charlie's determination and perseverance served her well. She responded positively to therapy. OT gave her the use of her hands. It's a good thing because she wants to be a doctor and a drummer. PT made it possible for her to run and jump, as you guys have all witnessed. And speech therapy is why she can talk and say, "Mommy, I love you." Her developmental progress far exceeded initial expectations. However, all of it came at a cost. I had to make impossible choices. Should I pay for her therapy or my exorbitant asthma medication copay? Choices like these aren't impossible, really. I choose to pay for hers and go without mine. One day, I needed an expensive dental procedure. Unfortunately, it was at the same time a therapy payment was due. Charlie's speech was emerging. I was afraid we would miss a window of opportunity in her development if we cut therapy. I chose to pay her therapy payment and put off my dental procedure. The decision cost me dearly. Due to the delay, an infection spread throughout my mouth and jaw. I went to the emergency department because the swelling in my mouth obstructed my airway. After a course of IV antibiotics, I was discharged. The next day, I had all of my teeth pulled, the infection drained, and parts of my jaw scraped away in a 6-hour procedure under local anesthesia. I could not afford to have it done under general anesthesia. I cried the entire ride home afterwards. Stories like mine should not happen anywhere, but certainly not in our country. Our healthcare system is broken. It's time we look to single-payer healthcare as a way of ensuring that families aren't faced with impossible choices like mine.
We are spending almost 18% of our GDP on healthcare, twice as much per capita as any other country. Healthcare for all is not only a moral issue, it is an economic issue. And we're going to bring up Mr. Richard Master, who is the CEO and founder of MCS Industries, a $200 million a year company in Eastern Pennsylvania, who's going to tell us why, as a businessman, he understands that the future of this country rests with Medicare for all. Richard?
Thank you. Thank you very much. Good afternoon. It's wonderful to be here today. 4 years ago, I started an investigation. I wanted to find out why every year at renewal time, my company faces double-digit increases in healthcare premiums. We spend $10 per hour to insure an employee with a family. We spend well over $2 million a year to provide insurance for a small group of employees in the United States. So I took a deep dive into the healthcare insurance industry in the United States, and I didn't like what I found. Every citizen in this country, regardless of their political leanings, must know the truth about this industry. It is a totally unnecessary middleman whose very existence costs businesses a fortune and adds no value. I produced a documentary called Fix It, Healthcare at the Tipping Point that presents the case in plain English. You should watch it. All of you should. If you aren't mad enough, when you finish that one, then watch the second one, Big Pharma Market Failure, and you'll really get mad. Here's the story in a nutshell. Insurance companies are making backroom deals with drug manufacturers and pocketing the money. Ever heard of a pharmacy benefit manager? Well, look into it. Other industrialized countries get better health results at half the price. The way we finance health care keeps wages flat, discourages businesses from hiring full-time employees, and causes discrimination against employees in their 50s and 60s. at 17% of our GDP, growing toward 18% and beyond in the 2020s. And growing, healthcare costs pose a real existential threat to the American economy. Warren Buffett was right. Medical costs are the tapeworm of American economic competitiveness. As a CEO, my job is to find best practices that maximize efficiency. Over the last 4 years, I've joined groups of equally concerned business people like Business Leaders Transforming Healthcare, and I have studied in depth the healthcare systems of other industrialized nations. There is no doubt at all in my mind that the best way to ensure the competitiveness of American business is with a single-payer healthcare system. Medicare deserves to be the single payer. It provides better results at lower prices, lower cost to our society, with more satisfied customers than any other insurance company in the country. Expanding that coverage to every citizen will improve both the health of our citizens and the health of our businesses. I applaud Senator Sanders and the co-sponsors for introducing this legislation and for embracing this central idea. Let me be clear. The so-called unfettered free market will never deliver the healthcare system we need if we are to remain an economic superpower. We've initiated a new campaign, Business Initiative for Health Policy, and the aim of this is to educate the public and lawmakers about the economic benefits of a single-payer system. I encourage every member of Congress to leave their ideology at the door and to work with us and with these fine senators to build a Medicare for all system to finance health care. Thank you.
Thank you very much. Thank you. Last but very much not least is Dr. Danielle Martin. You know, I think it is high time that we started taking a look at what countries around the world were doing in providing quality care to all of their people in a far more cost-effective way than we do. And one of the examples of a single-payer system that is working well, that is popular, is the Canadian system. Dr. Martin is a Canadian physician, healthcare administrator, and an associate professor at the University of Toronto. She is the author of a Canadian best-selling book, Better Now, 6 Big Ideas to Improve Healthcare for Canadians. Dr. Martin?
Thank you, Senator. I must say I'm very grateful that so many Americans are interested in learning about the experience of your Canadian neighbors under our single-payer healthcare system, which we also call Medicare. As a practicing doctor, a hospital administrator, and a citizen, I am so proud to be part of a system where access to doctor and hospital services is truly based on need, not ability to pay. And I'm not the only one. In public polls, 94% of Canadians say that our healthcare system is a source of personal and collective pride, even more than ice hockey. Single-payer healthcare is a symbol to us of what it truly means to be Canadian, that we take care of each other. Now, my grandparents immigrated to Canada in the early 1950s, like so many people who come to this country, hoping to build a better life for their kids. And at that time, there was no universal health coverage in Canada. So when my grandfather had his first heart attack in his early 40s, his world was shaken. And by the time he died nearly a decade later, the family was essentially bankrupted by medical bills. I know that this remains a reality for many in the United States today, but you should know that just north of your border, That kind of a situation is essentially unimaginable. My generation of Canadians does not remember what it was like to worry about paying a doctor or a hospital bill. And despite our challenges, which of course every country experiences, Canadians have a longer life expectancy, lower infant mortality rates, and fewer preventable deaths than in the United States. Single-payer healthcare is also, as you know, less expensive. In Canada, our administrative overhead is less than 2% in our public plans, as compared to 18% in the private plans here in the U.S. We spend just under $5,000 per capita in Canada to cover everyone. You spend nearly $10,000 per capita, and yet tens of millions of people are uninsured. But most importantly, when my patients are sick, I do not need to ask if they have insurance or if they can afford to pay for my services. And throughout my pregnancy, and for the birth of my daughter in a world-class hospital, I was never asked for money, and I never received a bill. I just handed over this card, my Canadian healthcare card, to my doctor, and that was it. I wish that all of my American neighbors could experience the same simplicity in their moments of need. And I hope that the American people will seize this opportunity to declare to each other and to the rest of the world that you do believe access to health care is a human right. Thank you.
Great job. Thank you, Dr. Martin. Today, all of us stand before you and proudly proclaim our belief that health care in America must be a right, not a privilege. Today, we begin the long and difficult struggle to end the international disgrace of the United States, our great nation, being the only major country on earth not to guarantee health care to all of our people. As proud Americans, our job is to lead the world on health care, not to be woefully behind every other major country. Today, we begin the debate vital to the future of our economy as to why it is that in the United States we spend almost twice as much per capita on health care as any other nation on earth, and yet we have 28 million people without any health insurance and even more who are underinsured with high deductibles and co-payments. As a result of the incredible waste, bureaucracy, and profiteering in our dysfunctional healthcare system, we are now spending nearly 18% of our GDP on healthcare, $10,000 per person. Incredibly, if we continue the status quo, we will spend an estimated $49 trillion over the next decade on healthcare. That is economically unsustainable for our country. Today, we say the function of a rational healthcare system is to provide quality care to all in a cost-effective way, and not to continue a system which allows insurance companies and drug companies to make hundreds of billions of dollars in profits each year, and to make healthcare industry CEOs extremely wealthy. Further, as you've heard this afternoon, the function of a good healthcare system is to enable people to get the healthcare when they need that healthcare, not to deal with an endless amount of paperwork and to spend hour after hour arguing with insurance companies about whether or not you have the coverage for the procedures that you need. The strengths of a Medicare for All program are not only its universality and its cost effectiveness. it also ends the complexity of a system which adds enormous stress at a time when people need it the least. And today we say to those families in Vermont and in Wisconsin and California and all across this country who are spending $10,000, $15,000, $20,000 a year on health insurance, that we understand that this is insane and unaffordable to be spending that much money simply to protect the well-being of your family. And we're here to tell those families and people all across this country that under Medicare for All, the average American family will be much better off financially than under the current system, because you will no longer be writing checks to private insurance companies. While, depending on your income, your taxes may go up to pay for this publicly funded program, that expense will be more than offset by the money you are saving by the elimination of private insurance costs. And today, we tell the drug companies that the American people are sick and tired of the greed of the pharmaceutical industry. We are no longer going to get ripped off and pay the highest prices in the world for prescription drugs under Medicare for All. We're going to negotiate lower drug prices for the government and for every single American. And today we tell the business community, especially small and medium-sized businesses, that we understand that you want to focus on your core business mission, not to spend countless hours worrying about how you will provide health insurance to your workers. And Medicare for All will allow you to do that, because all of your employees, by right, will have comprehensive health care. And today we say to millions of workers that you should not have to be stuck in a job that you don't want just because it provides decent health care to your family. With health care as a right, you will finally have the freedom to do the work you love and are passionate about, and our economy and our nation will benefit from that. 52 years ago, President Lyndon Johnson signed historic legislation that said in the United States of America, if you are 65 or older, you will be guaranteed health care as a right. And that legislation, called Medicare, has been enormously successful. We take it for granted now, but seniors in America are healthier, happier, and more secure than before the passage of Medicare. And today we tell our seniors that as good as Medicare is, we have heard your concerns, and for the first time, we will expand coverage to include dental care, hearing aids, and vision needs. Now, let us be honest. The crisis we are discussing today is not really about health care. Crisis we are discussing today is a political crisis which speaks to the incredible power of the insurance companies, the drug companies, and all those who make billions of dollars off of the current system. Over the years, these entities have done everything that they possibly can to prevent us from having lower-priced prescription drugs and universal health care. As one example, hear this. Since 1998, the pharmaceutical industry alone has spent over $3.6 billion in lobbying and hundreds of millions of dollars more in campaign contributions. And they charge us the highest prices in the world for prescription drugs. Now, I fully recognize that legislation which deals with 1/6 of our economy and over $3 trillion is complex, and that nobody, including those of us who are up here now, have all the answers. Unlike the Republican leadership, which tried to pass massive and destructive health care legislation without one public hearing, our job now is to take this legislation to every state in the country and to hear what the people have to say. Unlike the Republican leadership, we want to hear from doctors and hospitals and patient advocates and ordinary citizens as to how we can make this bill even stronger and more effective. We want to hear from the American people as to the fairest ways that we can fund this program. But to my Republican colleagues, please don't lecture us on health care. In the last few months, you, the Republican Party, have shown the American people what you stand for when you voted for legislation that would throw up to 32 million Americans off of the health insurance they have, and at the same time give huge tax breaks to the rich and large corporations. You, the Republican Party, have no credibility on the issue of health care. Let me conclude by telling you that I am extremely proud that we now have the support here in the Senate of 16 senators plus myself and a whole lot of folks in the House of Representatives. And importantly, we also have the strong support of dozens and dozens of grassroots organizations and trade unions representing the working people of this country. They know, as we know, that this struggle will ultimately not be won here on Capitol Hill, but through the grassroots activism of millions of Americans who are standing up and fighting back, who are becoming more engaged politically. And when we all stand together, we're going to be able to take on the insurance companies and the drug companies and Wall Street and everybody else, and to do what we should have done decades ago, and finally guarantee health care to all Americans as a right. Thank you very much. Okay. Tom here. Jeff. Senator Jeff Merkley of Oregon.
We have the most incredibly complex system of health care. Medicaid and Medicare, on exchange, off exchange, self-insurance, workers' compensation, children's health insurance program. We don't have one system, we have many. And in the course of that, for any given ordinary American, it's a lifetime of stress, a lifetime of trying to figure out how to negotiate this process with one simple goal, that when your loved one gets sick, they'll get the care they need. When your child gets injured, they'll get the care they need, and you won't end up bankrupt. Is our current system acceptable? No. Are we ready to fight together and work with grassroots America to change it? Yes. Let me tell you that at this very moment, there's folks out there on the Oregon Health Plan or the Medicaid in state after state after state, and they're afraid that when they get that additional couple hours a week, they won't qualify anymore. And then how can they sign up for the exchange? And can they sign up in the middle of the year? But then they have an employer who says, well, we'll pay your health care, but only if you pay in a huge amount of money. And they say, well, can I do that? But are my children covered? No, they're not. It's stressful, it's inefficient, it's ineffective, and we can do far better with Medicare for all. Peace of mind that when your child gets sick, they'll get the care they need, that you won't go bankrupt. I'm all in on this. Thank you, Bernie, for your leadership, and thank you for all of my colleagues and all of the organizations who are working together to make this happen.
Senator Kirsten Gillibrand, New York.
Thank you, Bernie. Thank you to Senator Sanders for his amazing leadership on this, along with all the colleagues and advocates standing behind me. The bottom line is this. Our democracy only works when regular people stand up and demand action. So thank you to all of you who are here today who have been fighting for Medicare for all year after year. As I've traveled around my state, one of the top concerns I hear from people is that health care is still too expensive. Under the health care system we have today, too many insurance companies continue to value their profits more than the value of the people they are supposed to be helping. It's time for something better, and I'm thrilled to announce that I support Senator Sanders' Medicare for All bill. One part of the bill that I worked with my colleagues to put in was the ability for every American to buy into a not-for-profit public option as part of a 4-year transition to get to single payer in this country. This would create affordable public health care that's available to any American to purchase in the already available exchanges. When I called for a not-for-profit public option during my first House race in 2006 in a 2-to-1 Republican district, it became very clear to me that this is not a partisan issue. Health care should be a right. It should not be a privilege once and for all. So I will be standing with Bernie, and I hope all of you, to make sure that every single American gets access to affordable, good quality health care with a single payer system in America. Thank you.
Senator Elizabeth Warren, Massachusetts.
Thank you. It is wonderful to be here with you today, but we have to remember the only reason we are here is because millions of people across this country made their voices heard. They believe that health care is a basic human right worth fighting for, and that's why we're here today. So thank you all. You know, back before I had this job, I had another job where I used to do a lot of work about just trying to understand what was happening to working families across this country and why so many people were going broke. And one of the principal studies that I did along with my co-authors was to introduce an idea called medical bankruptcy. The fact that hundreds of thousands of hard-working people across this country were filing for bankruptcy in the aftermath of a serious medical problem. And here was the real shocker in our data. 3 out of 4 of them had health insurance at the onset of the illness or accident that led to their bankruptcies. That's wrong. And today, it is an enormous honor to stand with each of you to say never again in America does anyone go bankrupt just because they got sick. Never. This has been a long fight from Franklin Roosevelt, who wanted health care for all as part of Social Security, to Lyndon Johnson, who gave us both Medicare and Medicaid, to Ted Kennedy, who made sure that our children were insured with CHIP, and to Barack Obama, who helped build the game changer that gave millions of Americans who didn't have health care coverage new health care coverage. We are here today to take another step. We will not back down in our protection of the Affordable Care Act. We will defend it at every turn. But we will go further. We will go further, and we will say that in this country, everyone gets a right to basic health care. That's what Medicare for All is all about, and that's why we're here. So that's our argument. Everyone gets covered, no one goes broke, and families in some of the toughest moments in their lives will not be left alone. I want to say thank you to Bernie for all that you have done. I am honored to be part of this fight. I am honored to have a chance to stand up and say one more time, health care is a basic human right, and we fight for basic human rights. Thank you all. Thank you.
Is Brian Schatz? Brian Schatz here? Oh, Brian left. Okay. Brian Schatz of Hawaii had to leave. The other senator from Hawaii is here. All right. All right. And we're going to get to that senator in a second, but let's bring up Kamala Harris of California.
Thank you. Thank you, Bernie. Well, I'm honored to stand with my colleagues and be in a room full of leaders. And this is a moment in time that I think we know is a very significant moment in time for our country, where we, all of us, are standing up and saying, let's just do what's right. You've heard so many folks talk about it because we know it. Listen, no baby is born in America born as a Democrat or a Republican. This should not be thought of as a partisan issue. It's not even a bipartisan issue. This is a nonpartisan issue. Cancer, diabetes, high blood pressure affects folks around our country regardless of whether they're in a red state or a blue state, regardless of their income, regardless of their status. And we should not differentiate in the way that we do public health policy. We should understand everyone, all, should receive the health care they need regardless of where they live, their income, or their zip code. And that's what this bill is about, and I am proud to co-sponsor it. It is about saying that this is about a right, not about a privilege for a few. And let's be clear, it is not only about what is the right thing to do morally and ethically. It's also smart in terms of the fiscal impact. Taxpayers will benefit. You know, our friends in the private sector, they talk about all the time. If they're asking about, are they being efficient, are they being effective? They ask that question with 3 letters. What is the ROI, return on the investment? Well, the taxpayers of the United States deserve a better return on their investment. And when you look at this situation, what we know, the public health model tells us so well. You want to deal with an epidemic? Smartest, most effective, and cheapest way to deal with it is prevention first. If we're dealing with it in terms of early intervention, and certainly if we're dealing with it in the emergency room, it's too late and it's too expensive. Let's give the taxpayers of the United States a better return on their investment, which means Medicare for all. And why? Because Medicare for all stands for the proposition that all Americans from the day of birth throughout their lives will have access to health care. It means understanding that the data tells us somebody with high blood pressure, if they are receiving consistent care, information about what they should be eating, testing and monitoring their blood pressure, we know if we reduce that population who have high blood pressure by just 5%, taxpayers will benefit by $25 billion over the next 5 years. Better return on the investment. Let's look at it in terms of the emergency room. If people resort to the only care they can get in an emergency room, as opposed to monitoring on a daily basis, on a regular basis with a physician that they know and trust, we're looking at right now in the United States $35.7 billion a year in unpaid emergency room bills. It's a better return on the investment for the American taxpayer, and that is why I'm proud to stand with my colleagues and friends and support Medicare for all. Thank you.
Is Cory here? Senator Cory Booker of New Jersey.
Thank you very much for giving some Jersey love. I am so proud to stand here today with my colleagues, with nurses, with doctors, with activists who understand the truth of our country. We were founded with incredible ideals, but we were far short from a reality that reflected the spirit of this nation. And every generation of our country has worked to expand access to our foundational ideals, that every American should have life and liberty, that we should have equal justice under the law, literally that we fulfill our pledge that we are a nation with liberty and justice for all. And so we fought, and people died to expand access, universal access to the ballot. We fought, and people died to expand universal access to civil rights. We fought and we struggled to make sure every child had universal access to public education. But when it comes to one of the most basic aspects of the ideals of life and liberty, you must include that every American has access to quality, affordable health care. And so this is the fight for our nation to live up to our ideals. Because you cannot have justice in this country where you have millions of Americans who cannot get access to basic health care because of the amount of money they make. You cannot have liberty when millions of American families are shackled and chained to fear and illness and sickness because they can't afford the medication or can't afford to go see a doctor. You cannot have a nation that professes to favor freedom if so many families feel the pain and the constriction of having to worry about affording their rent or being able to meet their basic needs of their family or pay to go to the doctor. And so now more than ever, we have to understand that this is a defining moment of the character of our country. How can we, the greatest nation on the planet Earth, have the most expensive healthcare system, fast approaching 20% of our GDP, but not get healthcare outcomes anywhere near our competitor nations? It is embarrassing to me. I love my northern neighbor, but it is embarrassing to me to have a Canadian stand here in the capital of the United States of America and talk about a system that takes care of their children better than we take care of our children, our most valuable natural resource. And we are leaving so many of our children in the insecurity, in the pain, and the agony of not having access to quality health care. And so I was getting a little competitive back here with some of the New Yorkers and the Californians. And so let me just end with the words of one of the patron saints of New Jersey, a man named Bruce Springsteen. He says it proudly. We are a nation that takes care of its own. I cannot sit when Australia or Canada or England takes care of every one of their children better than the United States of America. In this nation, this noble country, this country of love and compassion and empathy, we must stand up right now and say that we will be the symbol of hope and light and freedom and justice and liberty for all. Thank you.
Mazie Hirono is the great senator from Hawaii.
Thank you, Bernie, and aloha, everybody. Aloha. Thank you all for being here because you represent the millions and millions of people in our country for whom health care truly should be a right and not a privilege. That is the principle that unites all of us, that health care is a right, not a privilege for those who can afford it. That affordable, accessible, quality health care should be available to all. In other words, universal health care. Now, we're all one diagnosis away from a major illness. I certainly found that out about 4 months ago when I was diagnosed with stage 4 kidney cancer. Well, thankfully, I had health care, so I could focus with my doctors on what kind of of health care, I needed, whether I should have an operation or what, rather than trying to figure out how I was going to make painful choices as to some other obligations, fiscal obligations, economic obligations, as you heard. That should not be in our country. And so healthcare as a right, not a privilege. You heard so many wonderful speakers talking about the painful choices that they've had to make in this great country of ours. And therefore, I think about something that Dr. Martin Luther King also said, and I think he was paraphrasing someone who came before him, that the arc of history is long, but it bends toward justice. And justice is health care, quality health care for all as a right, not a privilege. And the road is going to be long, because just a few weeks ago, we were just one vote away from taking away health care from millions and millions of people in our country in one fell swoop. We were that close. So we know that we're going to have to keep on with this fight. It's not going to just happen because we are standing here united under the principle that health care is a right, not a privilege. The long road ahead is what is going to, I think, inform our actions over the next number of months. And truly, for us to be able to achieve health care as a right, not a privilege, is going to require all of us and the millions of people out there who care just as much as you all do, and for all of our families, for every American citizen. And I should mention immigrants, people who are in this country, 11 million undocumented people, 800,000 DACA participants who are about to be deported in the next 6 months. All the people in this country should have health care as a right, not a privilege. Aloha.
Richard Blumenthal, Senator from Connecticut.
Thank you. Thank you, Bernie. Thank you, Bernie. I think I may be the last speaker, and it isn't because I'm the best. It could be. Here are a couple of simple truths. Number one, health care should be a right, not a luxury. Number two, Medicare works. How do I know it works? That's how I know it works. It works for millions of Americans my age who remember what it was like historically. I wasn't there, but historically before there was Medicare. Medicare was a tremendous historic advance. And today we say everybody, no matter what your age, how much you make, where you live, should have those same rights. Now, the fact is, there's nothing novel or original about this idea. In fact, every nominee for the President of the United States, every Democratic nominee, from Truman to Clinton, advocated single-payer health care insurance. The difference now is that we have a chance to achieve it. And the reason we have a chance to achieve it is because of advocates like Bernie Sanders and Elizabeth Warren and my other colleagues here who are going out and talking about it to the American people. And what I pledge to do is I'm going to have hearings around the state of Connecticut, my state of Connecticut, and I'm going to give people in Connecticut a chance to tell me what they think. I'm going to listen to them. I challenge my Republican colleagues to do the same. Go out there and ask people whether they are in favor of Medicare for all, and I guarantee you, you'll get an earful. And here's another basic truth. You know, cancer doesn't choose red states or blue states. It doesn't pick people according to their party registration at the polls. It is an equal opportunity killer. Disease doesn't discriminate. And I want to single out two groups of people. Number one, the women of America. They have been denied health care for too long because of restrictions like the Hyde Amendment. Consider the Hyde Amendment history if we pass Medicare for all. And all those other restrictions on reproductive rights. And to our colleagues who talk a lot about the opioid epidemic, there are millions of Americans who will be awake tonight worrying about their spouses, their children, their loved ones, their friends, their coworkers who need and deserve treatment, and they won't get it now. They will under Medicare for all. They need it. They deserve it. Health care should be a right, not a luxury. Access to this basic right is as American as our flag. We are the greatest country in the history of the world. We owe it to ourselves and our children to make sure we have Medicare for all. Thank you.
Good job. Okay. I want to thank all of our guests who traveled here today to talk about the need for Medicare for all, and all of my colleagues here in the Senate and our friends over in the House, and mostly the American people. And here is the simple truth. Our opponents on this issue have the money and they have the power. But if millions of people across this country stand up, get involved in the political process, and fight back, I have no doubt, none whatsoever, that this nation, sooner than people believe, will in fact pass a Medicare for all single-payer system, and finally, health care will be a right for all in the United States of America. Thank you all very much.